Are you taking your daily medications with a glass of grapefruit juice, a healthy spinach salad, or a bowl of yogurt? You might think you're making healthy choices, but what if I told you that these very foods could be interacting with your prescriptions in a way that silently harms your kidneys? It's a shocking thought, but it's a reality I've seen countless times in my 30-plus years as a doctor specializing in the health of our senior community. The statistics are staggering. Nearly 70% of seniors are taking multiple medications every single day. That's a lot of opportunities for something to go wrong, and often, the danger isn't the medication itself, but a hidden conflict happening on your dinner plate. Your kidneys are your body's sophisticated filtration system, working tirelessly day in and day out. But as we age, they become more vulnerable. Overloading them can lead to damage that you might not feel until it's serious. Today, we're going to pull back the curtain on 3 common, seemingly healthy foods that can pose a significant risk when mixed with certain medications. This isn't about scaring you, it's about empowering you. The good news is, with the right knowledge, protecting yourself is simple. Let's start with the first one, a popular breakfast staple, grapefruit. Many of my patients are surprised by this. Let me tell you about Richard. Richard was in his late 60s, a retired teacher who was doing everything right. He was taking his statin for cholesterol, exercising, and he started every single morning with a large glass of fresh grapefruit juice, believing it was the peak of a healthy routine. But then he started experiencing debilitating muscle pain and weakness in his legs, so severe he could barely get out of his chair. He was worried, and frankly, so was I. After running some tests, we discovered the problem wasn't his medication dose, it was his breakfast. Grapefruit, and to a lesser extent some related citrus like Seville oranges or tangelos, contains compounds called furanocoumarins. Scientifically speaking, these compounds block a critical enzyme in your liver and intestines known as CYP3A4. Now, what does that mean for you? Think of the CYP3A4 enzyme as a traffic cop in your body. Its job is to break down and process a huge number of medications, directing them where to go and ensuring they leave your system on time. When grapefruit blocks this enzyme, it's like the traffic cop goes on an unscheduled break. Traffic in this case, the medication piles up, the drug isn't broken down properly, and its concentration in your bloodstream can skyrocket to dangerously high, even toxic levels. For Richard, the statin was building up in his system, leading to a condition called rhabdomyolysis, a serious form of muscle breakdown that can cause severe kidney damage. The very kidneys he was trying to protect by lowering his cholesterol were now under direct attack from his breakfast routine. This interaction is particularly dangerous with common senior medications like statins. Atorvastatin and simvastatin are big ones. Many calcium channel blockers used for blood pressure like amlodipine, and even some immunosuppressants. Have you ever actually read the tiny warning label on your prescription bottle, or do you, like Richard, just focus on the main instructions? It's a small detail that can have life-altering consequences. The solution, thankfully, is straightforward. Swapping grapefruit for other fruits like oranges, berries, or apples completely avoids this dangerous interaction. For Richard, the change was night and day. Within a couple of weeks of cutting out grapefruit juice, his muscle pain vanished. He was able to get back to his life, all because of one simple dietary change. Now, let's move on to our second category, which includes some of the most highly recommended vegetables for a healthy diet: dark leafy greens. I'm talking about spinach, kale, collard greens, and Swiss chard. What could possibly be wrong with these? Well, for the millions of seniors taking blood thinners like warfarin, also known as Coumadin, the answer is vitamin K. Let me tell you about a lovely patient of mine, Eleanor. After a small blood clot was found in her leg, her doctor put her on warfarin to prevent a more serious event like a stroke. Eleanor, determined to improve her cardiovascular health, decided to overhaul her diet. She started making kale smoothies for breakfast and eating giant spinach salads for lunch. She felt great, but when she went for her regular blood test, her numbers were all over the place. Her doctor couldn't stabilize her dose, and she was frustrated and scared. The problem was the vitamin K. You see, vitamin K plays a vital role in helping your blood to clot. Think of it as the agent that creates a scab to stop bleeding. A blood thinner like warfarin works by directly opposing the action of vitamin K, making your blood less likely to form dangerous clots. They exist in a delicate balance. When Eleanor suddenly flooded her system with massive amounts of vitamin K from all those greens, she was essentially canceling out the effect of her medication. Her blood became too thick, putting her right back at risk for another clot. Now, here is the most important point, and I want you to hear this clearly. The goal is not to avoid these incredibly healthy foods. The key is consistency. Your doctor sets your warfarin dose based on your normal diet. If your normal diet includes a small salad every day, that's perfectly fine. The danger comes from sudden, dramatic changes. Going from eating almost no leafy greens to eating huge amounts, or vice versa, is what throws that delicate balance into chaos. It's like trying to drive a car by slamming on the gas and then hitting the brakes. It creates a jerky, dangerous ride. Have you ever considered how much your diet varies day to day? That's a question most of us never think about, but for someone on a blood thinner, it's a critical piece of the health puzzle. You and your doctor are a team, working to find that perfect, stable dose that keeps you safe. Finally, let's talk about our third category, dairy products. Milk, cheese, yogurt. These are the cornerstones of bone health, especially for seniors looking to prevent osteoporosis. But for those taking certain types of antibiotics, that glass of milk can render the medication useless. This happens with common antibiotics like tetracyclines and fluoroquinolones, which includes ciprofloxacin, often used for urinary tract infections. The issue here is a chemical process called chelation. The calcium in dairy acts like a powerful magnet. When you take your antibiotic pill with a glass of milk or a bowl of yogurt, the calcium latches onto the drug molecule in your stomach. This bond is so strong that your intestines can no longer absorb the medication. It passes right through your system without ever entering your bloodstream to fight the infection. I remember a patient, Frank, who was battling a persistent UTI. He was taking his Cipro exactly as prescribed, but he wasn't getting better. During a follow-up, I asked him to walk me through his routine. He said, "Doc, I take it every morning with a big glass of milk to protect my stomach." It was a classic light bulb moment. His good intentions were sabotaging his treatment. But there's a second, even more direct risk for seniors who already have compromised kidney function or chronic kidney disease. Dairy products are naturally high in phosphorus. Healthy kidneys have no problem filtering out excess phosphorus. But for kidneys that are already weakened and struggling, processing a high phosphorus load is like asking an exhausted runner to sprint a marathon. The kidneys can't keep up. Phosphorus builds up in the blood, and over time this can pull calcium from your bones and even lead to dangerous deposits in your blood vessels and heart. So what's the solution? It's all about timing. For the antibiotic interaction, the rule is simple. Separate them by at least 2 hours. Take your antibiotic with a full glass of water, and then wait 2 hours before you have any dairy or even a calcium supplement. For instance, take your pill at 8 a.m. and have your yogurt at 10 a.m. This gives the medication plenty of time to be absorbed properly. If you have known kidney issues, talk to your doctor or renal dietitian about the right amount of dairy for you. It's a perfect example of how personalized medicine truly is. The advice for one person is not always right for another. So now that we've discussed these specific interactions, I want to take a step back and talk about the bigger picture. Why are our kidneys so much more vulnerable after the age of 60? It's a question I get asked all the time. The answer lies in what I call the perfect storm of aging. First, there's the natural, unavoidable process of aging itself. Think of your kidneys like the engine in a classic car. When the car was brand new, the engine was powerful and could handle anything. But after 60, 70, or 80 years and hundreds of thousands of miles, that engine, while still reliable, has less horsepower and a bit more wear and tear. It needs higher quality fuel and more careful maintenance. Medically, we call this a decline in the glomerular filtration rate, or GFR. It simply means your kidneys have less filtering capacity, less of a buffer to handle stress than they did when you were 20. This is a normal part of aging, but it sets the stage for potential problems. Next, we add in the second factor, polypharmacy, As we get older, we tend to accumulate more prescriptions, one for blood pressure, one for cholesterol, maybe another for diabetes or arthritis. Each of these medications and their byproducts must be processed and cleared by your kidneys. One or two medications might be fine, but when you're taking 5, 6, or even more, you're asking that aging engine to do the work of a heavy-duty truck. It's a tremendous workload. And here's an important new piece of information I want to share. This doesn't just apply to prescriptions. Millions of seniors take over-the-counter pain relievers like ibuprofen or naproxen every single day for aches and pains, thinking they are completely harmless. But these drugs, known as NSAIDs, can be very tough on the kidneys, especially when taken consistently over a long period. The third factor that completes this perfect storm is the risk of dehydration. As we age, our sense of thirst can diminish. We simply don't feel thirsty as often, and many people forget to drink enough water throughout the day. Dehydration forces your kidneys to work much harder to filter a more concentrated brew of waste products. When you combine this natural decline in function with a heavy medication load and insufficient hydration, you can see how easily our kidneys can become overloaded and strained. And the most dangerous part, you usually don't feel it. Kidney damage is often silent, with no obvious symptoms until a great deal of function has already been lost. That is why my message is so urgent. Your kidneys are your body's filter, don't overload them. So what can we do? This is where you take back control. Let's create a simple, practical plan with safer alternatives and timing strategies. First, for the grapefruit issue, the swap is easy. Instead of grapefruit, enjoy a bowl of mixed berries with your breakfast. They are packed with antioxidants and won't interfere with that critical CYP3A4 enzyme. Berries, apples, bananas, you have plenty of delicious and safe options. Second, for leafy greens and blood thinners like warfarin, I'll say it again, consistency is king. If you love spinach, you don't have to give it up. Just aim to eat a similar amount each day. Don't have a tiny side salad one day and a giant kale smoothie the next. A food diary for 1 week can be incredibly revealing and help you and your doctor find that perfect balance. Third, for dairy and those specific antibiotics, the 2-hour rule is your golden ticket. Let's imagine a day in the life of my patient, Mary. She takes her blood pressure pill in the morning with oatmeal and a sliced peach. For lunch, she has her usual turkey sandwich and a small, consistent-sized salad. She's on a temporary antibiotic, which she takes with a big glass of water at 4 p.m. This is 2 hours after her lunchtime yogurt and a full 2.5 hours before she sits down to a dinner that might have some cheese on it. See how simple that is? It's not about a radical diet overhaul, it's about smart, simple scheduling. Does your daily routine protect your kidneys, or could it be accidentally working against them? A few small tweaks can make all the difference. Now, I want to leave you with a concrete, 4-step action plan that you can start using the moment this video ends. This is how you transform this information into real-world protection for your health. Step 1. Become a health detective. I want you to go to your medicine cabinet, take out your prescription bottles, and look at them. I mean really look at them. Check the pharmacy labels. You'll often find small but crucial warning stickers. Do any of them mention grapefruit? Do they say to take the medicine with food or on an empty stomach? These aren't just suggestions, they are vital instructions, designed to ensure your medication works effectively and safely. You might be surprised by what you find. Step 2. Talk to the most accessible expert on your healthcare team, your pharmacist. Pharmacists are a goldmine of information, and their expertise is one of the most underutilized resources we have. The next time you pick up a prescription, don't just rush out. Bring a list of everything you take, and I mean everything. Prescriptions, over-the-counter pain relievers, vitamins, herbal supplements like St. John's wort or ginkgo biloba. Ask them plainly, are there any potential interactions here that I should be aware of, especially with my diet? A 5-minute conversation could be life-changing. Step 3. Listen to your body. Our bodies often send us quiet signals or whispers long before they start shouting. If you're on a statin and start experiencing unusual muscle pain, don't just dismiss it as old age. If you're on a blood thinner and notice more bruising than usual, pay attention. If an infection just isn't getting better despite taking antibiotics, it's a red flag. And be aware of the more subtle signs of kidney strain. New or worsening swelling in your ankles, feet, or legs, a level of fatigue that feels deeper than just being tired, or changes in how often you need to use the restroom. These are signals that you need to discuss with your doctor. And that brings us to step 4. Schedule the most important appointment you can make this year. Call your doctor's office and specifically ask for a medication review. This isn't just a quick chat at the end of a regular checkup. This is a dedicated appointment where you sit down with your doctor for the sole purpose of evaluating every single pill and supplement you take. It's an opportunity to deprescribe, to identify potential conflicts, and to ensure your regimen is as safe and effective as possible for the person you are today. Your health is truly in your hands. The power to protect your kidneys and ensure your medications are helping, not harming, begins with knowledge and proactive steps. Please don't feel overwhelmed. Just start with one thing. Tonight, look at one medication and think about the foods you eat with it. That's it. That's the first step on a safer path forward. Protect your kidneys. They are the silent workhorses of your body, and they depend on you to make informed choices. Thank you for spending this time with me. If you found this information helpful, please subscribe for more senior health tips and share this video with someone you care about. And be sure to check out our other video, Evening Habits That Ruin Your Kidneys. For more essential advice, I'm Dr. Robert Clark. Stay informed, stay healthy, and I'll see you in the next video.